This video will review how to complete a speech therapy evaluation visit. The first thing you'll do is check in and enter your check-in time. You'll see a page similar to this. You'll notice I have cut off the top section. This is to avoid giving away any private patient information. Next, you will address incident report. Have there been any incidents since the patient's last visit with any clinician, such as a fall or emergency room visit? If so, you will select yes and report the incident. If not, you can select no. Patient identification, you'll want to identify 2 ways that you identified the patient. You'll select patient tolerated session well and standard precautions observed. These are required to enter your note. However, if the patient did not tolerate the session well, you can comment on that later in your note in the care coordination box. Next, you will address vital signs. You'll enter the patient's vitals. If the vitals are outside of normal range, which you can find the normal ranges in this button over here, you will need to notify the doctor right after your visit within the same day. You'll document in care coordination that you notified the physician, and you'll also document any new instructions from the doctor if there are any. Diagnosis you don't need to do anything with, but it is a good place to review any past medical history. Medications you don't need to do anything with. However, if the patient reports a new or changed medication since their last visit, with any clinician, you'll need to enter a change order with that medication change. There's a separate video on how to enter a change order, so please review that video. Nutritional requirement, allergies, DME, safety measures, functional limitations, and activities permitted. These should all auto-populate from the start of care. If they don't, just edit them appropriately using these buttons. You'll then address mental status and their rehab potential. Moving on to medical information, prior level of function, past medical history, down here reason for evaluation, and then any medical precautions or limitations. Throughout the note, you'll notice these quick text buttons. If you click this, it'll pull up options for text into your text boxes. It can also include guidance on what we're expecting in those boxes. So please feel free to use those. They can be very helpful, especially if you're feeling lost and not sure what goes in those text boxes. Next, we're moving on to living situation. Who do they live with? What kind of support do they have? And any other information on their home environment. Homebound reason will need to be addressed at every visit by every clinician. Is the patient homebound? Yes. Select why. And then in addition to selecting these boxes, you'll need to comment on why. Now we're moving on to the speech therapy evaluation portion. So you will complete the observation and the speech language evaluation portion to the best of your ability. There is a key here at the top for what these numbers mean, and then you'll go ahead and complete the appropriate sections. Standardized tests, you can ignore that section unless you have a particular outcome measure test that you want to add. Pain, you don't need to fill this out because even though this is here, we do require a Wong-Baker form that we'll get to later under the Forms tab. So typically we'll just enter C. Wong-Baker. Plan of care, you'll select any items that you plan to address during the episode. Frequency duration, C. Care coordination. We'll be entering our frequency request in our care coordination note later, so we don't enter that here. Any equipment recommendations, any safety issues, instruction, or education. And then you'll enter your assessment summary here. I recommend you copy it because you'll paste that again later in your care coordination box. From here, there's a button to add from library. It'll pull up a new window where you can select your goals and interventions. You can select whatever goals and interventions you feel like are appropriate for your speech therapy category. There will also be a general category where you'll need to select a COVID goal and intervention, and there'll be a pain category where you'll need to select a pain goal and intervention if the patient has any pain at any time, even if they don't have pain during your evaluation. If they report occasionally having pain, you'll want to enter a goal and intervention for that. Those will show up here on your evaluation to review and edit if needed. Then we're coming down here to summary. Care coordination, who did you coordinate or communicate with? Rehab potential, discharge plans. If you are only evaluating, you can select evaluation only. Discharge, discussed with who? Patient and or caregiver are aware of and involved in planning. Yes. Again, physician acceptance of plan of care. We'll say C, care coordination or pending, as the physician hasn't signed off on this yet by the time you're doing your evaluation. Skilled treatment provided, you'll enter here. Don't forget about the quick text buttons here to help guide you through those. Plan for next visit, you'll enter what your plan is. Best practices being followed, that's things like COVID precautions, standard precautions, diabetes precautions, whatever precautions are appropriate for this patient. Again, don't forget those quick texts. And then comments, you don't need to put anything in this box, but if you have any additional comments or information you'd like to add, you can enter that there. Scheduling, you can ignore. The case manager will enter your frequencies once they're approved. And then again, down here in care coordination, this is where you'll paste your summary. You'll also want to enter your frequency request. So normally before the summary, you'll want to enter requesting speech therapy twice a week for 2 weeks, once a week for 2 weeks, effective whatever date. Whatever frequency you're requesting, you'll enter there. This will automatically go to the care coordination section for the case manager and other disciplines to see. You can also enter any other information in here that you feel is appropriate that needs to be communicated. Now, before you sign off on your note, you will scroll back up to the top and we'll go to interventions. There will be a button here that says perform interventions. You will select that. It'll pull up a new window that will let you comment on the interventions, any interventions that you performed during your evaluation. Then you'll move on to goals. You don't need to address every goal at every visit, but you want to address at least 3 or 5 goals and the progress towards those goals at every visit. Within a 2-week time period, every goal should have been addressed at some point during that 2 weeks. If a goal is met, even on your initial eval, you can select goal met. Next, we're going to go to forms. This is where you'll add a new form. You'll enter your Wong-Baker pain assessment and your COVID screen. It'll bring that window up for you to fill out those forms at every visit. Those are required. Any additional outcome measures or forms you want to use should be available here. The only other things you may need would be, other forms you will need would be the iterator form and the auth request form, and those are addressed in separate videos and won't be in the note. So we're going to go back to the main evaluation. We're going to scroll down to the bottom, and then you can enter your signature. After every evaluation, you'll need to fill out an iterator form or a functional impairment level assessment form. It looks like this. Every single patient should have one of these completed for them on evaluation by every discipline. You'll just go through, you'll put the patient's name in here, their current status, and their goal status. So where are they right now? Where do you want them to be? These will be on your devices. These should be uploaded on the patient's chart to documents, again, with every eval. If the patient requires authorization, these are only some insurances, there is a separate video and decision tree to help guide you in requesting that additional authorization. But that is the end of our speech therapy evaluation video.